Hi, my name is Annalise Meek, and today I will be talking about vaccinations. So even though vaccinations aren't a new development or invention, they're still receiving a lot of attention, especially lately. And this is a result of people believing that vaccines are causing more harm than good. Parents are beginning to remove their children from the recommended vaccine schedules, which not only puts their child at risk, but it also primes the environment for the rise of an epidemic. Diseases that we thought that we had left behind are now able to come back again. Based on the research that I've done and the evidence I've come up with, my opinion is that vaccines should be more widely administered. There should be a stricter schedule that children need to stay on. Support of this opinion is shown by first showing the counterclaims and many of the reasons that people have against vaccinations. Then I'll go through each of these opinions that other people have and refute them with the research that I have found. The first counterclaim that I'll go over today is that vaccinations cause autism. This is brought up in an article by Shannon Honeybloom, and it tries to make the connection between the age when people develop autism and the age when people, well, children specifically, the age when they receive the greatest amount of vaccinations. Other individuals are strongly against the way vaccinations are reviewed and approved. They say they do not spend enough time testing vaccines, that they're poorly reviewed. They say that vaccinations need more time to ensure that they're safe for the people that they're receiving them, and that they need more testing to determine the risks that are involved in vaccinations. With the following information, however, it will be clear that many of the arguments made against vaccinations are not supported by evidence. After a great deal of research, it has been determined that many of the concerns people hold about vaccinations have never been proven. There are only a 1 in a million chance, and it has never been a direct correlation between the vaccine and the harm that people think it causes. The first link that I will address is between vaccines and autism. Many people believe that the MMR vaccine is linked to autism, but an unbiased group of scientists did a great amount of research studying the two, and they concluded that there is no harmful association. In the article mentioned before, Honeybloom doesn't take into account the difference between correlation and causation. With correlation, they may be going like this, together, in two lines, parallel to each other, but neither line is really affecting the other. They just happen to be going at the same time. With causation, on the other hand, there is a direct influence between one event and another. The lines may look a little more like this. This line caused the other line to change its direction. This is a direct cause. One of the people that started the controversy between vaccines and autism was named Andrew Wakefield. He raised great concern throughout the whole nation. His research is considered one of the most serious frauds in medical history because there had only been 12 participants in his whole study. This is very inaccurate, saying that this small number that he found in his research could be applied to the whole nation, to the whole world. Inaccurate information, no matter how large or small, as we can see with Wakefield's example, it can impact the actions of individuals throughout the whole nation. All of this information can be put together to conclude that vaccines have not been proven to cause mental illness. Because of this, fear of mental illness being caused by vaccination is not a reason to stop vaccinating. There hasn't been enough proof to support the claims linking the two. Another reason vaccine schedules should be maintained is to prevent the return of deadly epidemics. These epidemics were previously treated, but now we're seeing some of them return. Just because an illness such as polio or smallpox are not a current threat to people doesn't mean that they have disappeared. The decline of deadly epidemics and common illnesses are one of the reasons vaccines should be kept around. Data has shown that as there's an increase in vaccinations, there is a decrease in common illness. This can be seen on a graph similar to this one. As vaccines continue to go, common disease and illness decline, almost reaching zero. In some cases, it does reach zero. Illnesses that were once common are not a concern anymore due to vaccines keeping them at bay. But once the environment allows the diseases to return, they will return. We'll start by understanding how vaccinations are approved and processed. Vaccines go through many clinical trials, advisory committees, and even more studies in order to get approved. When talking about the approval process for vaccinations, it's important to understand how experiments work. The nature of any experiment is this: you never know every risk or every potential outcome. Because of this, it's impossible to go through every risk a vaccination might cause. This will take years and years. The FDA does a very thorough job, however, approving vaccinations and doing as much testing as they can before they give them the license. As I talked about before, there are many fears that people face about vaccinations, and that's okay. It's okay to be afraid of something that's new to your body. But this is also why doing research is very important. This research leads to the conclusion that vaccinations are, in fact, very beneficial. Their administration should continue to be a priority because many of the concerns people hold about vaccinations aren't entirely truthful. Not only do vaccinations strengthen one's ability to fight disease, but it also prevents the return of deadly epidemics from the past. I hope you've learned from this video a lot about vaccinations and their importance. Thank you.